Despite the good news that the Omicron variant appears to be less severe, healthcare professionals are extremely concerned their workforce will catch it.
The concern comes as experts believe the variant is more transmissible. News 9's Erica Rankin explains new guidance for workers.
That is absolutely a concern that we've been talking about for the last month, considering the Omicron variant.
Dr. Mary Clark says there's no reason to believe that healthcare workers won't be affected by Omicron like everyone else.
If we start to see more and more breakthrough infections, then we may not have the staff. And we already have a staffing issue. We have had a staffing issue for years.
Frontline leaders say they're already seeing warning signs in other states as Omicron is spreading.
Hearing, some places up to 10, 15% of staff being out at any one time, that's a scary deal for us.
We would really be struggling to keep our ICU beds open and to provide care for all the patients.
With the fear of a potential surge in what is known about the severity of the Omicron variant, the CDC released new emergency guidance for healthcare facilities, which relaxes the rules on isolation and quarantine for healthcare professionals, which at a crisis level could mean someone with COVID-19 is able to work in the healthcare setting.
We would obviously keep them in medical grade masks and things like that. We've already had conversations that we would keep those people away from anybody who was highly immunosuppressed.
But doctors say this really only particularly happens if there's a high admission rate into the hospital.
Remember, another thing that could happen, we could have an influenza outbreak in January, which could fill up our hospitals again. So there are just a lot of unknowns at this point.
We'll just have to wait and see and play it by ear. We have lots of different strategies based on this, that, and the other, based on different possibilities that could come to fruition.
Erica Rankin, Oklahoma's own News 9.